It is 6:17 now. News 3 is taking action for your health this morning. May is National High Blood Pressure Education Month, a time to learn more about hypertension and the potential dangers it presents.
So high blood pressure, as we know, can lead to a lot of trouble. Heart disease, stroke, hypertension. So that's why we have our very own medical expert, Dr. Ryan Light with TPMG at Greenbrier Family Medicine here with our morning rounds today.
So let's talk about the numbers. What should we aim to see when we check our blood pressure?
Well, the ideal blood pressure goal is 120/80. Recently, they just redefined hypertension as 130/85. So if you're less than that 130/85 and around that 120/80, you're in a good range.
All right, that's where you want to be. And how often do we need to be checking this? You know, you go to the drugstore and there's a little cuff machine out there, or when you go to the doctor, what's the normal amount of time?
Well, you should check it at least once a year.
Okay.
So it is often referred to as the silent killer. So people who have hypertension can have it for years without ever checking it. So you want to be aware that you have it. So check it as often as you can, and if you see one of those cuffs, check it.
All right.
All right, so good advice there. What are some of the signs and symptoms of high blood pressure? We know it's called the silent killer, but there are some telltale signs.
So some things that people can see are headache, visual changes. Sometimes you can get shortness of breath, fatigue. You can also get some chest pain, irregular heartbeat, and you can also see a little bit of pulsatile sensation in your head or neck.
And years ago when I got diagnosed with high blood pressure, it was the headache. I had a headache that wouldn't go away, and it was dangerously high, so make sure you're getting those things checked.
And when you're looking at these symptoms, who is most at risk of seeing this?
Anyone. So you
Great.
can be at risk, and it really goes by family history. Cultural things have to deal with it, and really your diet has a big play in it.
And diet is also a big way we can treat it as well.
Yes, we should all be following a low salt diet. So looking for foods that have preservatives in them. So look at the sodium content on those. The other thing is if you're preparing food, you want to make sure that you're not adding salt when you're making it. You want to make sure you don't add salt after it's made. And that should get you into the low salt diet.
All right, Dr. Light, thank you so much. Good information for all of us this morning.